ACL reconstruction is one of the most common orthopedic procedures in the United States. And for 30 years, the treatment and surgery has been about the same until now. Doctors say a medical breakthrough has led to a new, less invasive option for reconstruction. And in tonight's HMG Health Matters, we sit down with the first surgeon in the state of Tennessee to perform the procedure using the so-called bear implant. She says it's a game changer.
1 in 3 people will tear their ACL at some point in their lives. So it may happen when you're young playing a sport, but it can actually happen as we age. Even just, I've seen people walking across the yard slip wrong and tear their ACL.
And for decades, Dr. Ramey says the standard of care is to reconstruct the ACL.
We use the word reconstruction because we're actually having to rebuild a new one. When the ACL tears, it's usually fraying quite significantly, and so it's been hard to repair it back together again until the invention of something called the bear.
Dr. Ramey says the bear implant allows the torn ligament to heal itself, so instead of reconstruction, it's restoration.
We have been trying in our specialty of sports orthopedics to perfect ACL reconstruction year after year after year, and there have been improvements made, but there hasn't been a real breakthrough innovation until now. So the bear implant stands for Bridge Enhanced ACL Repair, and it's a way to take a repair, those frayed ends of the ACL that I mentioned before, and repair them back with a scaffold. So with a collagen scaffold that the patient's blood can then grow.
Dr. Ramey specializes in sports orthopedics. She was the first surgeon in the state of Tennessee to perform the bear implant procedure. She says it is still surgery with a similar recovery time. There is still a brace and physical therapy, but for certain patients, it can make a big difference.
The studies show that with the bear surgery, people tend to feel more normal faster, and that has been my experience in my own patients. Sometimes I actually have to slow them down, ask them to do less because they feel so normal at month 3 or 4.
The procedure is FDA approved for adults, teens, and children with confirmed ACL tears. Dr. Ramey is the only surgeon in our region offering the bear implant. She says she is honored to be able to provide options to her patients. To learn more about this medical breakthrough, please visit the Health Matters blog at holstonmedicalgroup.com.